and today we'll be talking about Medicare. I will go over different parts of Medicare and we'll try to answer as many questions as possible. And hopefully this session should help you summarize the Medicare program, compare the parts of Medicare and coverage options, describe Medicare covered services and supplies, recognize Medicare rights and appeals, explain programs for people with limited income and resources. What is Medicare? That we'll start with program basics, and we'll discuss enrolling options in enrolling in original Medicare Part A and Part B benefits and cost. So what is Medicare? It's Medicare currently provides health insurance coverage for over 54 million U.S. citizens. That's approximately 1 in every 6 Americans. Medicare is health insurance for generally 3 groups of people. So first, those who are 65 years and older, people under 65 with certain disabilities who've been entitled to Social Security disability benefits for 24 months, includes amyotrophic lateral sclerosis, hopefully I said that right, ALS, also known as Lou Gehrig's disease. Again, I hope I said that right, without a waiting period. People of any age who have end-stage renal disease, ESRD, which is permanent kidney failure that requires a regular course of dialysis or a kidney transplant. The Centers for Medicare and Medicaid Services administers the Medicare program. Just want to note that to get Part A and or Part B, you must be a U.S. citizen or a lawful present in the United States. If you live in Puerto Rico, you must actively enroll in Part B. Lawfully present means you are in the U.S. legally and includes non-U.S. citizens who have permission to live and or work in the United States. So Medicare has 4 parts. Medicare covers many types of services, and you have options for how to get your Medicare coverage. So again, Medicare has 4 parts. Part A is hospital insurance. It helps pay for inpatient hospital stays, skilled nursing facility care, home health care, and hospice care. Part B is medical insurance. Helps covers medically necessary services like doctor's visits and outpatient care. Part B also covers many preventative services, including screening tests and shots, diagnostic tests, some therapies, and durable medical equipment like wheelchairs and walkers. Together, Part A and Part B are also referred to as original Medicare. Part C, Medicare Advantage, MA, is another way to get your Medicare benefits. It combines Part A and Part B and sometimes Part D, which is prescription drug coverage. Medicare Advantage plans are managed by private insurance companies approved by Medicare. These plans must cover medical and necessary services. However, plans can charge different co-payments, co-insurance, or deductibles for these services than original Medicare. And finally, Part D, Medicare prescription drug coverage, helps pay for outpatient prescription drugs. Part D may help lower your prescription drug cost and protect you against higher cost in the future. If you are already getting Social Security benefits, for example, getting early retirement at least 4 months before you turn 65, you'll be automatically enrolled in Medicare Part A and Part B without an additional application. You'll get your initial enrollment period package, which includes your Medicare card and other information about 3 months before you turn 65. Coverage begins the first day of the month you turn 65, or 3 months before your 25th month of disability benefits. Coverage begins your 25th month of disability benefits. If you're not getting retirement benefits from Social Security or the Railroad Retirement Board, you must sign up to get Medicare. Now, if you live in Puerto Rico and get benefits from Social Security or the Railroad Retirement Board, you will automatically get Part A the first day of the month you turn 65, or after you get the disability benefits for 24 months. However, if you want Part B, you'll need to sign up for it. If you don't sign up for Part B when you're first eligible, you may have to pay a late enrollment penalty for as long as you have Part B. So basically, make sure you contact your local Social Security office or the Railroad Retirement Bureau for more information. So let's move on. Medicare card. I've heard that we'll be seeing a new card, but I'm not going to disclose too much information on that. We'll probably have a separate meeting regarding that issue. So Medicare card, when you have original Medicare, you use your red, white, and blue Medicare card when you get healthcare services. The Medicare card shows the type of Medicare coverage, Part A and or Part B you have, and the date the coverage started. Your card may look slightly different from this one, but it's still valid. The Medicare card also shows your Medicare claim number. For most people, the claim number has 9 numerals and 1 letter. There also may be a number or another letter after the first letter. The 9 numerals indicate which Social Security record or Medicare is based on. The letter or letters and numbers tell you how you are related to the person with that record. For example, if you get Medicare on your own Social Security record, you might have the letter A, T, or M, depending on whether you get both Medicare and Social Security benefits or Medicare only. If you get Medicare on your spouse's record, the letter might be a D or a D. For railroad retirees, there are numbers and letters in front of their Social Security numbers. These letters and numbers have nothing to do with having Medicare Part A or Part B. You should contact Social Security or the Railroad Retirement Board if you receive railroad retirement benefits, if any information on the card is not correct. If you get your Medicare card in your initial enrollment period package and keep it, you keep Part B and will pay the Part B premium, unless Medicaid pays your premium. If you don't want Part B and decide to enroll later, you likely pay a late enrollment penalty. If you don't want Part B, follow the directions on the back of the card and return it. We'll describe the reasons why you might want to delay taking Part B later in the presentation. So if you want to choose a Medicare health plan, your plan will likely give you a card to use when you get healthcare services and supplies. Okay. If you aren't getting Social Security or Railroad Retirement Board benefits at least 4 months before you turn 65, for instance, because you're still working, you'll need to sign up for Part A and Part B, even if you're eligible to get Part A premium free. You should contact Social Security 3 months before you turn 65. If you worked for railroad, contact the RRB to sign up. You don't have to be retired to get Medicare. Full retirement age, also called normal retirement age, had been 65 for many years, right? However, beginning with people born in 1938 or later, that age gradually increases until it reaches 67 for people born after 1959. The 1983 Social Security amendments include a provision for raising the full retirement age, beginning with people born in 1938 or later. Congress cited improvements in the health of older people and increases in average life expectancy as primary reasons for increasing the normal retirement age. So that is we clear on that. Very important issue when to enroll in Medicare. Your first opportunity to enroll in a Medicare is during your initial enrollment period, IEP, which lasts for 7 months. Your coverage starts based on when you enroll. If you enroll during the first 3 months of your IEP, the 3 months before the month you turn 65, your coverage will begin the first day of the month you turn 65. If you enroll the month you turn 65, your coverage will begin the first day of the next month. If you enroll in the last 3 months of your IEP, the 3 months after you turn 65, your coverage will begin 2 to 3 months after you turn 65. If you're eligible for a premium-free Part A, you can enroll in Part A once your IEP begins. So again, this is 3 months before you turn 65 and any month afterward. If you're not eligible for premium-free Part A, you can only enroll in Part A during your IEP or during the limited Part B enrollment periods. For everyone, whether you get premium-free Part A or have to pay a premium for it, you can only enroll in Part B during first your IEP, initial enrollment period, the annual general enrollment period, which runs from January 1st through March 31st of each year. In a limited situation, such a special enrollment period, if you don't enroll in Part B or Premium Part A during your initial enrollment period, you may have to pay a penalty. For Part B, it's a lifetime penalty for as long as you have Part B. If you didn't sign up for Part B or Premium Part A during your initial enrollment period, you can enroll during the general enrollment period. The general enrollment period occurs January 1st through March 31st each year. If you enroll in a general enrollment period, your coverage will begin July 1st. If you aren't eligible for Premium Free Part A and you don't buy it when you're first eligible, your monthly premium may go up 10%. You'll have to pay the higher premium for twice the number of years you could have had Part A but did not sign up. Generally, if you don't take Part B when you're first eligible and more than 12 months have passed since you turned 65, you'll likely have to pay a penalty that's added to your monthly Part B premium. The Part B penalty is 10% for each full 12-month period you could have had Part B but didn't sign up for it. In most cases, you'll have to pay this penalty for as long as you have Part B. There are very few special enrollment periods for Part B and Premium Part A allowed by law. Most people don't qualify for an ASAP. However, if you're still working, you may be eligible. The special enrollment period allows you to enroll after your initial enrollment period and not wait for the general enrollment period, and you won't have to pay a penalty. To be eligible, you must have employer group health plan coverage based on active current employment. If you are 65 or older, you must get this employer-sponsored coverage based on your spouse's current employment. If you have Medicare-based or disability, you can also have employer-sponsored coverage based on a member's current employment. People who get Medicare based on end-stage renal disease usually don't qualify for a special enrollment period. You must have this employer-sponsored coverage for all the months you were eligible to enroll in Part B, but you didn't. For most people, this means you had employer-sponsored coverage since you turned 65. If you're eligible, you can enroll using the special enrollment period at any time while you had employer-sponsored coverage based on active current employment. If you lose either the if you lose the employer group health plan coverage or the current employment, you have 8 months to enroll. If you don't enroll within the 8 months,